At 11:33. Let's go to the Lord in prayer. Father, thank you for today, for granting this special time to us. May we use it to utilize for our constituents, and we know that health care is of utmost importance, and may we utilize our time and our resources to deliver those resources, because many of them have acute needs and chronic needs. May they all be addressed. Father, bless this time together in Jesus' name. Amen. Oh, Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petskowski. Here. Keith Austin.
Here.
Danny Callison.
Here.
Julia Coates. Here. Sean Crittenden.
Here.
Joe Deere. Rex Jordan. Johnny Kidwell.
Here.
Daryl Legg.
Here.
Wes Snowfire. Joshua Sam. Mike Shambaugh. Melvina Shotpouch.
Here.
E.O. Smith.
Here.
Kendessa Teehee. Victoria Vasquez.
So we have a quorum, Shelley? Okay, thank you. I assume you've had time to look at the minutes. Would entertain a motion to approve. All those in favor? Aye. Any opposed? Motion passes. Moving on to reports. We'll see Mr. George Valier up first from the Claremore Service Unit. Thank you, George, for coming.
Good afternoon.
Hello, George.
You have my report in front of you. Visits are climbing. Now that the flu and the RSV have started to slow down a little bit, visits to the emergency room are starting to drop. I checked this morning, and over the long weekend, they averaged about 80 to 90, just under 100 for the whole weekend, which is substantially less than they were the past couple of months during the flu and the RSV outbreak, so to speak. Things going well there. Collections are on par with like they were last year. Last couple of months, we closed the drive-through testing facility out front because of the cold weather. When it hit 30 below, we brought them all back inside that week. And then last week, a week before, when it got cold there for a couple of days, we brought them back in again, and they worked out of the emergency room. We're still giving vaccines, all the vaccines down in the vaccine room on the east end of the building, down just the other side of pharmacy. We're working on we're trying to add a second generator, power generator to the facility. We have one, and the majority of the hospitals on it. The one thing that the two things that aren't on that generator are the chillers, and we're trying to remedy that. As if we lose power during the winter, we can stay warm. We're trying to get a second generator because the first generator's capacity won't hold the chillers, so we're adding a second generator. We've got that project working with area office to add a second generator for the chillers and anything else we can add to it in the rest of the building. So that's going well. And we started a project. It's been ongoing, but I was told this morning that they should actually start removal of the old fluoroscopy unit in X-ray. So that's going to be replaced. That should be starting in the next couple of months. They'll take the old one out, rebuild and do construction to support the new unit and get all that put back in, and then we'll be back up and running with the new fluoroscopy unit. Any questions?
Questions for George? Joe?
Mine's more of what we talked about that people didn't know, that I guess there was a crash right down from the hospital when I talked to you, and they had requested to go to IHS in the ambulance, and then we learned that certain ambulances have contracts with St. John's or Hillcrest, and so they're not allowed to go IHS. I just thought people would want to be aware of that because it was a minor wreck, but they took them off the site. But even though they request to go to IHS, they're not allowed to go to IHS because of the contracts. So that was just a clarification that me and Value worked out, so. That was just more of an FYI if you run into that. Most of those ambulances that were, if there is an IHS facility, it depends on the ambulance and their contracts.
Okay.
So that's all I had, but I thank you for taking my call that Saturday. So we were trying to figure that out. And you said the time was what, 24 hours that they need or 48 hours they need to call?
72.
72 hours to contact IHS that they were taken to a different hospital.
Thank you, Counselor.
All right, thank you.
Danny?
Couple quick, George, on that deal, so Claremore is gonna pay for them even though that they're right there close to the hospital if they won't take them to the hospital?
What, just be sure and, be sure and call us in that 72 hours, and it'll go through review committee, and we get records, and it'll go through, and the docs will look at it. Now, if
So-
they get diverted, if they'll tell them to go ahead and call and get diverted, yeah, we pick that up.
So there's no guarantee that if they take them to another hospital, that they're gonna get paid?
That's correct.
One other question, when you see, and you and I talked about this the other day, the ER, I know you guys meet, once a week for your referrals out? So what happens on the weekend, and you and I had this situation with the 2-year-old that broke his arm? You know, by the time he gets referred and get to there, it's almost 5 days, 6 days. You know, is there any way we can work out a situation where, you know, if he needs to see an orthopedist, you know, before 5 days is up, that there's any way they can get him to that? And I know our deal was anything referred outside comes through the Cherokee Nation, is that correct?
If they're Cherokee tribe, yes.
Yeah, so if they go in there and this is what I'm trying to get together, if they go in there on a weekend and they're Cherokee and they've got a broken arm, you don't have an orthopedist on staff to look at that arm.
No.
So how do they, because that's going to be outside contract, right?
Correct.
So there's really no need for them to go to Claremore if they're going to have to go back through Tahlequah to get the arm looked at. Is that kind of where we're at on this deal?
Or Monday morning, we would take that referral and send it over to Cherokee Nation Contract Health, PRC, and they would send it out and schedule it.
And you're probably talking a time frame of, by the time you get from one person to the next person, 3 or 4 days after it's already happened on a Saturday.
Well, if it happened on a Saturday, Monday morning, we come in and we see an outpatient referral for a Cherokee Nation citizen, it would go over that Monday morning.
Right. I know we talked, and it, you know, and I know this is the way it goes, but I'll just tell you that the 2-year-old, he couldn't get to see the orthopedist till Wednesday afternoon. So he went from Saturday to Wednesday before he would, because the orthopedist is a specialist out of Tulsa that just didn't have a date for him. There wasn't any appointments open. So, you know, with that said, that may be something the nation and us, we need to get together. And I know you told me that when they come in, the doctors aren't allowed to see if they're Cherokee or not.
Nope.
You don't let them do that. So I know that was a situation, you know, you know, we're going to need to work out somehow to get something a little quicker.
And again, I'm perfectly willing, you know, happy to sit down and we could talk
Right.
about that and talk to Steve Carey in his office and whatever we need to do to expedite that.
Right, right. And you've been very helpful with that, and I appreciate that. And I'm not doing it as, I just want the council to be aware. This is kind of, you know, this is kind of where it went with the 2-year-old till it was finally Wednesday afternoon before he finally got to see the specialist, you know, on the broken arm. So, you know, anyway, thank you, George.
Any other questions for George? Just a brief note on your report, George, you said at Claremore we had 7 babies this past month, I guess. Is that kind of an average number? 7 babies in a month?
No, that's a lot less.
Yeah, that low number kind of,
That's a low number.
yeah. Guess the noon one, right?
I can't figure out what attributed it that.
Have to go back 9 months to see what.
Yeah.
Yeah. Do a little research and development, okay. Okay, thank you, George. Dr. Stephen Jones. Cherokee Nation Health Services.
Good afternoon. Well, we'll start off, just kind of go over the report. If there's anything on that you have any questions over, it's all the same things we report every month. We'll open that up for questions at the end, I guess. A few things I want to highlight is we talked last time about the RSV clinic that we had for our kids, a fast track through urgent care. Those numbers have started coming down quite a bit in the last 2 to 3 weeks, so we will be discontinuing that fast track as of Friday of this week and getting our people back in their clinics in their regular places. Still available for same days with our pediatric department. There's still urgent care and there's still ER services. We just won't have that fast track that's set aside for RSV in the hospital. Want to give a shout out to Samantha Hendricks and her group. We've implemented a new salary schedule and a new marketing analysis program that she's been working on for quite some time. We started that a couple of weeks ago, and it's going to give our hiring managers a little more fluidity and a little more decision-making process and compensation. Everything that we've done the last 2 weeks has been right in the ballpark where it's supposed to be. We're not having to make exceptions or get waivers to hit the market. So it looks like this is going to be, it's still a work in progress. We're still working through some of the details, but as far as we're concerned, it's a huge win for us and our people, our nurses that we're recruiting right now. We're hitting right where we need to be with them. So I think it's going to really be a game changer on getting some of our vacancies filled. So I want to give her a shout out. She's been working on that for quite some time. Construction projects are moving. Most of them have closed that are in the clinics now. We have a few moving that are a little bit delayed. I think Nowata, we've got the dental clinic open now, but we've ran into a few bugs and we're working through those, but they are still seeing patients. You may see a lot of dirt being moved here in the Tahlequah campus where they're starting to get the parking area developed so that when we take away the parking for CNOC, where the hospital's going to go, we have a place for employees and patients to park. So if you see a lot of dirt moving there to the north of the campus, that's what that's about. Let's see here. We did have, through that hard freeze, we did have some buildings that developed some water leaks, and we've been working through that process for the last week and a half, and got some mediation to do in some of our areas where we had some flooding and things of that nature, where our buildings just aren't ready for those type of freezing temperatures. I do want to talk just briefly about the COVID numbers, and within Cherokee Nation Health Services, we did have an increase there between November and December. It started climbing. We did kind of hit a peak, and we've started to see that trend come back down to, I think we're at 31 cases per 7 on the 7-day moving average a week. So, so we are starting to see that trend coming back down, which is good news. And the other thing I want to talk about a little bit is we're implementing a new STAR program. Hopefully you guys are all getting our Healthy News newsletter. I asked that be sent to each one of his personal email, and it's just kind of gives a highlight of what's going on in health services. We publish that quarterly, and there's a whole section in there about a new program we just started this month called the STAR program, which allows our employees to recognize one another for things that go on in the day-to-day activities. It allows for our supervisors to recognize employees, and each quarter we'll be rewarding them. And at the end of the year, we'll have a banquet that's going to be pulling those winners into an awards banquet in October. So you might catch that in the newsletter and read a little bit about it. It's just another way for us to recognize all the stuff that's going on day to day that, you know, we get busy and we move through it, and sometimes we miss some of those opportunities. So this is an opportunity for our employees to also get engaged and help us recognize their co-workers and staff. And with that, that's all I'm going to report right now. If there's any questions or comments, I'll be glad to take them.
Committee members, have you been getting the newsletter, health newsletter that he referenced just now? Have you? I have not, but.
You'll see it come as Healthy News.
Okay.
Yeah.
Very good.
So,
That's quarterly, so we could have got
quarterly.
it 90
There should have been
days
one
ago.
just came out last week.
Okay. Well, I'm not sure I got one. Any questions for Dr. Jones? EO?
Do you know how many students we have in the doctor's program
That's it?
up there.
In the med school
Uh-huh,
or
in
in
our
the
med school.
residency?
In our med school.
Med school. So we're on year 3, so we have 150 on campus, so, it'll start when we get full
So
going
they're
with
all
all
three
years.
full, all 3 years full.
And some of them, and that's average, I don't know if it's we've had some dropout or additions, they'll have some that transfer out and in. But that's, when we get fully going, which will be next year, we'll have 200. Yeah.
Well, I know at intertribal health meeting, every tribe is experiencing the nursing shortage, and I assume we're still in it.
Yes.
Every tribe is, even entities outside of tribal providers are as well. Do you see any end game in that? Is there more training, more nurses in the pipeline? Can we support other training programs? Or we're just gonna kind of have to let it play itself out here, Dr. Jones?
The problem that caused this shortage is contract nursing and traveling nursing. So they've created this market or this environment where people can come and work, 3 months out of the year, or, it changes up the flexibility of how the nurses work in our systems. So that's been the biggest problem, and because of that, they've elevated the markets to a point that a lot of health systems can't afford it. So the one thing that we're looking at is how are we going to let our nurses work at the height of their licensure and hire those LPNs to do the things LPNs should be doing, nursing assistants, the things they should be doing, and let our RNs work at the top of their license. I don't know that we've done a good job of that in the past, so making us more efficient. We do work with several nursing programs to take rotations or do clinicals, so that gives us exposure to for recruitment. We're doing that, and we have been doing that consistently since the shortage. But overall, it's a bigger problem. There's more nurses retiring than there are coming out of programs. So it's not unique to us. It's throughout the nation, as you said, and it's not just unique to Oklahoma. So we're looking at different opportunities. We're working with career services to look at some apprentice-type programs that are out there. There's still some legislation that's got to be done to allow those type of things to develop, and so we're working proactively with those changes to try to allow that to happen, more on-the-job type training. So there are things coming in the pipeline, and like I said, with this market tools that HR has given us, I think those vacancy rates are going to come down considerably in the next few months.
Great. Well, I noticed recently Integris announced some layoffs, but I assume that they didn't lay off any nurses.
Yeah, I think they announced 200 layoffs.
Yeah. Okay. And our vacancy rate, is it ticked up just a little bit, our vacancy rate? Is that attributed to the
It
nurses?
usually does in the spring as people are finishing up their scholarship paybacks and things of that nature, and we're getting ready to enter that recruitment time that's so crucial when we end up February through August or through July, of people finishing their programs and residencies and things of that nature. So we usually tick up a little bit now, and then it'll come down a little bit at the end of summer. So, and some of that has to do with vacancy rate, that we added new positions for this year on our budget that weren't there before, and they go in to figure into that vacancy rate. So, so as we grow, that vacancy rate fluctuates, or especially in the spring before that recruitment time comes.
Okay. Danny?
Dr. Jones, will we advertise, like for our nursing positions and our LPN positions, even our physicians, do we actively advertise to recruit these folks to tell them, hey, you're not gonna be able to go to St. Francis and make any more money than what you're gonna make here? Are we in a process of letting people know that, so they don't think that, we try to get the best for our money?
Yeah, so a couple of years ago, we added nursing to part of the requirements for our recruitment people to work on. That wasn't something that was on the radar previously, so they are actively recruiting now, just like we do for mid-levels and for physicians and dentists and all those professional positions. So, yes, we are doing that, and I do get a report that, tells me where we're at and what they've been doing, what job fairs they've been hitting, what schools they've been visiting. We're trying to be a little more active in going out to the schools and sending some of our own nursing leadership to meet with the schools, meet with those applicants, and tell them a little bit about us, even the ones that don't do rotations with us, to try to help with that recruiting process. Yeah.
Mike?
This doesn't have, I guess, anything to do with that, but I saw something on the internet I thought was interesting, and it says the Department of Veteran Affairs to waive medical copays for Native American, Alaskan Native vets. So I don't know if you're aware of that, but that's kind of a big deal, that they're finally coming through with something they said they were going to do, and that'll have a good impact on our vets.
And they don't have any copays with us. So if anybody that's eligible for our services, veterans come through, there's no copay. So it's unique outside of our system, but in our
Yeah.
system, it's the same as it's been before. And I think that has to do with behavioral health, if I remember right, when I read that article earlier.
Yeah. I thought that was kind of interesting. I didn't know that they didn't have a copay with us, so.
Yeah.
All right, thanks, sir.
Joe?
You said that they're going, your staff's going out to schools. What schools are they going to, or have they gone to already?
I couldn't tell you that for sure, but I can probably get you a list
Okay.
of what schools they've attended. Now, it's nursing schools, and, they go out to dental schools, they go out to medical schools, they go out to any place that has a place that we're going to be recruiting from locally. That's Stephanie Wycliffe and her group reaches out, and if they are allowing us to come and do a talk or visit with their students, then depending on what the specialty is, depending on what who's available, we send people out to do that.
I would assume TCC is part of that group.
Yeah, I believe so. We get a lot of hygienists from TCC,
Yeah.
and we have a pretty active recruiting going on with them.
Yeah. Can you just have them email me a list whenever they get time?
Sure.
All right, thanks. Thanks, Chair.
Dr. Jones, I saw where there's at least some proposed state legislation about a bill to lower the payment to doctors via Medicaid, Medicare. Are you familiar with that bill, where that is, or if how it would impact us if they lowered the payment to doctors for their services?
Typically, it doesn't impact us because we're on the federal OMB rate, so we're not fee-for-service, so typically those type of things don't impact us directly. But we do stay on top of that, and we have, government relations is on, when they see something coming through that they need our input on to help with lobbying or whatever else that they need, they reach out to us and we give them that information or work with them to get that information to who needs it.
Okay, thank you. See no more questions. Thank you, Dr. Jones.
All right, thank you, guys.
Ms. Lisa Pivek from Public Health, our interim director of Cherokee Nation Public Health. Thank you, Lisa.
Sorry. Good afternoon. It's always good to come and share information about our public health programs and to answer any questions you may have on our report. You have our report in front of you. I have a couple of things that I would like to highlight on that report for you today. Our public health accreditation is reached out to us today, the FAB accreditation, and said that our pre-site visit review will be conducted soon, so we're moving closer to that reaccreditation. It's a long process, but hopefully we'll have that finished pretty quickly. We are getting ready to do the Youth Risk Behavioral Survey again in schools that were selected by CDC in Eastern Oklahoma, and on the reservation, rather. We are working to get the 2021 data in a user-friendly format so that it's out there for everyone to see on our website and that we can give some infographics out. One of the things I can tell you about the 21 survey is that youth vaping continues to rise at alarming rates, and so we're really looking into that and what we can do in the sense of youth vaping. That's the tobacco industry switch to getting someone addicted to tobacco is to start the vaping process, and we're working really hard on that. Now, we collect that data every 2 years through CDC, and they select the schools in a random sample, and then we go out to the schools to do that, and then we get the information back. And we've been doing it since 2010. On the off years, we do what's called school health profiles, where we interview and talk to the school administrators and the health education teachers and physical activity teachers in the school. I want to talk to you about a new award that we just received that you saw on the report. It's from the Substance Abuse Mental Health Services, and we are working on, it's a grant for the Suicide Prevention Hotline, the 988, and we're working closely with Cherokee Nation Behavioral Health Services on this project. I know that Cherokee Nation Behavioral Health is really working hard to get people in to be seen and to make sure they meet that need, and this is a help in that area. It basically closes the loops on those calls that come from Native Americans to the 988 that are on the reservation. So it's a follow-up. It provides training to all the call centers specific to Cherokee Nation so that those people who are answering the phone have more education. And some of the dollars can go directly back to behavioral health or health services for direct services and direct care. So working closely with Julie Skinner and looking forward to this project. If you notice on Wings, we added 5 more races. We're trying to get to our pre-pandemic number. We're up to 17 races, and the schedule is in there. Hopefully that you've seen that, and we've implemented we're doing a QI project with Wings, and we've implemented what you might call a customer satisfaction survey. So after each race, the participants get a link to take a survey about how they like the course, what we can do better, how things are going, and there's also a QR code that folks can get while they're right there and take that as well, and we're trying to encourage people to do that so that we can improve that program. As you may have seen in Health's report, the Special Diabetes Program for Indians just got refunded, and we partner with Health Services to deliver the school grants program. So we are working, they just recently got refunded, and we're working on getting that application put together and out to schools. The other 2 things I'd like to do is highlight, if you'll look at the last page of the report, you'll see that the community health workers' work out there is exceptional. In December, with all the holidays, I think they touched 694 people, but you can see the breakdown of who they referred those to, what services they got referred to. And as I mentioned, again, this is a pilot-type project that we're doing, and it is focused on first language speakers, but they serve any Cherokee citizen as well that they're working with. But I want to give a good shout out to them. They do an excellent job in our communities and are available 24/7 to help anybody, and want to make sure you know about that. The last thing I want to do is, I think I've mentioned before that we're moving in public health to what's called results-based accountability to measure, evaluate our programs. It's a slow process getting there and getting everything in place, but I'm happy to report that Amanda Spencer, who is our Director of Performance Improvement, just got certified in results-based accountability. I think she is the only one at Cherokee Nation who's done that so far, and she'll be able to teach others within Cherokee Nation and across anywhere else on the performance management system, which we're hoping yields some great results. And other than that, happy to answer any questions.
Questions for Lisa? Victoria?
Yes, just, Lisa, could I see you after the meeting? I have a question in particular about one of my clinics. Thank
Yes,
you.
absolutely.
Danny?
Yes, ma'am. I seen in your report where you're sponsoring, for example, a run in Pryor. Do you sponsor the whole thing, or is that just, I know last year, I think Counselor Shotpatch and I sponsored through the Hope Coalition these runs. Is this the same thing, or is it a different one?
So the way that our Wings program works now, in the past, in years past, we might sign up and pay individual race fees. We'd pick a race and we'd pay those race fees. We've had to restructure due to our funding source. So we actually put on all of the races that are on the race schedule, meaning that we organize them, we do the contracts with the race organizations, and we try in every community to partner with a nonprofit in that community that serves Native people, and those people who come to the race who are not Wings members and pay, they actually get that money back. So we don't make any money, but we also are not able to really attend other races and pay race fees. But yes, we put on all of these races, and happy to visit with you about anything that you'd like to try and do.
Others?
I forgot one thing
Okay.
that I wanted to mention. The WIC program is hard at work right now, trying to get the seniors farmers market and the other EBT out there. The seniors farmers market program will start, I believe, in April, and that is a one-time card that goes out to all seniors, and it's not just Native, but everyone, and we're looking forward to that. And the other EBT process is in place so that WIC will be able to use their benefits at farmers markets as well.
At the recent intertribal health meeting, was anything relevant there that would impact Cherokee Nation public health that you know of?
We have a consortia of the public health teams that meet afterwards. The only thing is to continue to press on data sovereignty. And that's one of the issues that we talked about in our public health meeting, was the need to make sure that any type of data from our public health programs that's going outside of Cherokee Nation, that we know about that. Recently, there was an ask by the tribal epidemiology centers to have access to all tribal data. And I believe CDC came to a good mix for that, in that they can request that information from whatever agency it is, but the tribe, then it goes to approval for the tribe to look at. So that was impactful.
Okay.
And we also had lots of discussions around RFAs and RFPs, requests for proposals from CDC, and ensuring that we get tribes added to that, and that when we do apply, we are not subject to having anything from the state. One recent application was requiring that we have an MOU from the state education or the state health department, and we clarified, we went to CDC and clarified it, and now the tribes do not have to have that. So those were the main things.
Junior, do you have something?
I just, on that vaping, are we targeting younger kids now? Because I've noticed just where I live in the school, that younger kids are doing it a lot more, because they're easier to hide in it than carrying a pack of cigarettes.
Yeah, largely our efforts are still around schools and school policies and helping schools to implement those policies on site. We're also working through a youth cessation training program that hopefully, but that's a little bit harder to get kids to come to a cessation class, I would definitely think. But I think the biggest thing is to assist your local school districts and any local youth organizations that you have in putting that in place. We're also need to, and we're looking at a multimedia campaign at some point for, to youth vaping, to prevent youth vaping.
Nobody?
Lisa, on the lease run, are they limited to how many they can run, does the lease pay for? Is there a limit?
No, there's no limit, because we pay for the whole race.
Oh, okay.
Yeah,
they
so,
can run
yeah, yes, ma'am.
Any other questions for Lisa? Okay, thank you, Lisa.
Thank you.
Okay, I see, okay, old business, none pending, new business, none pending. I do have a couple of announcements. Any of our committee members have any announcements? Okay, I'll have Dr. Jones elaborate on this on the next monthly meeting, but we were recently, Cherokee Nation, designated a primary stroke center certified center, which is big time. Not too many folks have a stroke or able to offer stroke care. And if any of you've had family members and perhaps yourself have a stroke, you realize time is of the essence. Sometimes minutes can matter. So I neglected to have Dr. Jones elaborate on that, but next month we want to have him elaborate on that if we could. Next month is scheduled to meet Monday, February 13th at 1 p.m. That's a different time. We've been meeting at 12:30, and it seems like we're getting business done within the hour, so we're just going to start at 1 o'clock next month, February 13th. I think that's due to the leadership that we have. They come and give complete reports, which answers a lot of our questions beforehand, but it seems like we're getting business done. The pandemic's a little bit behind us. The dust is settling a little bit, but anyway, we're going to, next month, meet at 1 instead of 12:30. Speaker?
Hey, Doc, do you remember, if I read that, was rehab included in that too? It was, wasn't it?
I believe so, but I wish I'd had Dr.
Right.
Jones kind of elaborate.
That's a big deal
Yeah,
too,
it
that
is.
rehab is
Yeah.
monstrous after
Yeah,
a
it
stroke,
is.
so. All right, thank you, sir. That's
is.
good info.
Well, I may catch him off guard. I'm sure. Dr. Jones? Well, from now on, he'll leave for you. I don't know if you've been eavesdropping or not, but I just announced that we were a primary stroke center certified now.
Yes.
Do you fill in the blanks on the details of that?
So we're at the second level of that. First is allows us to treat the patient and get the patient in, stabilize them, send them out, and now we're able to keep the patient there. So, and administer TPA and do the things that we need to do right away. So I heard you say you would like some information on that next time, so I'll get somebody to come in and give you a full rundown of
Okay.
what those qualifications, what we're able to do, and what those stages of those different certifications are.
Okay, great.
Okay.
Any other questions? Okay, great. Need one more motion. All those approve of adjourning, say aye. Any opposed? We're adjourned.